Well, hello everyone. I almost was going to do an April Fool's Day and no show, but I got here just in time. I had a wonderful appointment with a beautiful family. Started about 3 hours ago, and didn't think I was going to get done, but I ran over here from Mayo Clinic's clinical tower, the Gonda building, to be with you here in my research tower, the Guggenheim building. So great to be with you on this first day of April, April Fool's Day. I'm Mike Ackerman, genetic cardiologist here at the Mayo Clinic and director of Mayo Clinic's Windland Smith Rice Genetic Heart Rhythm Clinic and the Windland Smith Rice Sudden Death Genomics Laboratory. But as always on these Fridays, for I think it's episode number, it's getting close to number 90, but I think it's 88 or 89. I'm here on behalf of the Sudden Arrhythmia Death Syndrome Foundation, the SADS Foundation, for SADS Live, as we've been for 2 years of this COVID-19 pandemic. And it's been great to be together with you, to have you in my life. I've been blessed because of your presence and your comments and your questions. I've learned so much from you, and all of you inspire me and inspire us at the SADS Foundation as we continue with our primary mission to help you live and thrive despite your particular SADS condition, whatever it is. And today we're drawing particular attention to the syndrome called Brugada syndrome, discovered by and named after dear friends of mine, the Brugada family. And so for those of the families that I take care of with Brugada syndrome and those throughout the world with Brugada syndrome, today's initial comments are for you. And then we are going to tackle questions that come along about that entity or any entity represented by those joining us. And I have Laura joining in from Scotland. And it's been a long time since I've been in Scotland. But guess what? Making my first transatlantic trip to Europe tomorrow since the pandemic. The pandemic canceled European Heart Rhythm Association 2020, which was to be in Vienna, Austria. But I leave tomorrow for Copenhagen, Denmark. And so hopefully in whatever ways, we're all kind of getting going again. I bet I'm going to be wearing that mask thing that I can't wait. Maybe Delta Airlines will get rid of the mask by tomorrow. Wouldn't that be incredible? I don't get it. Doesn't make sense to me why I should have the mask on, but I don't want to get kicked off of those airplanes. So I'll be a good, obedient individual. So on behalf of Alice Laura, the president of the SADS Foundation, thanks for being part of us and for you, because it is all about you. I'm going to have Aaron bring on a special person as we talk about Brugada syndrome and Brugada syndrome awareness. And unfortunately, this story, as some of them are out of tragedy. And so we're going to have Linda Reubens from Niagara Falls come on and join us. And Linda, welcome to SADS Live. It's great to have you on, although I wish circumstances were different, that we would be sharing a success story and a wonderful story instead of a tragic one. But maybe, Linda, you can tell us about your son, Tom, and how things unfolded, and then we'll go from there. So thanks for joining us, Linda.
Hi, Mr. Ackerman, or Dr. Ackerman. Nice to meet you, and thanks for this opportunity to tell our story and raise awareness about Brugada syndrome. I'd like to start out. My husband, Hale, was diagnosed with hypertrophic cardiomyopathy, HOCM, as a teenager. It was controlled medically pretty well until he was in his late 40s and began experiencing more symptoms. At that time, he had a septal myectomy and a pacemaker was implanted. Since this is genetic, we had our boys checked for this, and we were looking for a structural abnormality. And as you know, Brugada is an electrical issue. That's just a little background.
Yeah.
Yeah, I could I could tell you stories about Tom for the next 40 minutes. Tom was the second oldest of our four boys, Joe, Tom, Dan, and Mike.
Hmm.
I can honestly say Tom accomplished more in nearly 30 years than many people double his age. This is our family. I have a picture of us. You might want to see that.
So
That's
it
my
looked
youngest
like
son.
the boys, all four of your sons, they were evaluated because your husband had a different heart muscle condition called
Correct.
hypertrophic cardiomyopathy, and they were tested for that, and all four tested negative.
Yeah. Yeah, we
So
never
they,
found anything.
so they had normal echoes, normal tests, but then somewhere along the line, something awful happened for Tom in his 30s. What happened?
Well, Tom, he was a very sweet, curious boy with many interests like whales, baseball, dinosaurs, and geography. And he grew up to be a thoughtful, kind, generous man with even more interest, like history, nature, especially trees, board games, cats, and he loved to share his knowledge. Tom wasn't afraid of working hard and learning how to succeed at whatever interested him at the moment. He did just that in high school. He joined the cross country team, and his first 5K was under 26 minutes, which that's not very good. So he worked hard. He set goals for himself, learned about nutrition, strategies, and he trained hard, and it paid off. He set school records in several long distance track events, and he became a New York State cross country champion. He also received the New York State Sportsmanship Award. So to this day, his coach from high school still tells his students how Tom improved from 26 minutes to being a state champion.
Hmm.
So Tom, he ran through high school and he continued into college. In addition to the yearly required school physicals, we took Tom to a few different cardiologists as we were concerned about the hokum. And Tom, he was running 80 to 100 miles per week by then, and he received a clean bill of health. Tom loved history, and he worked as a reenactor at Old Fort Niagara for several years. He earned a bachelor's degree and a master's degree in history. He worked long hours teaching Western Civ and other history courses at two different community colleges at the same time. And as an adjunct professor, he had no benefits and he had no health insurance.
Hmm.
And while he was teaching, he found time to earn a degree in horticulture. He loved being out in nature, and the idea of doing good work with the environment held much appeal for Tom.
So Linda, maybe you could tell us, when did things go horrifically wrong for Tom?
Well, in 2018, things were really looking good. And we were very proud of our sons. Dan graduated from podiatry school. Mike earned 2 master's degrees. Tom was inducted into his high school, the Wall of Fame. Tom, Mike, and Joe were married within 4 months, and it was pretty crazy, but it was an exciting time, and we were looking forward to traveling and grandkids and just enjoying our expanding family.
So Tom was how old then?
Yeah, 7 months after Tom's wedding, it was 2 weeks before he turned 30. Tom died in his sleep May 25th, 2019. And as far as I know, his first symptom was his last.
And do we know at that time, so was there a medical examiner, coroner investigation to try to figure out the why?
Well, what happened then, after Tom's funeral, my older son, Joe, was going to go on a vacation. And my husband's a family doctor, and his colleague, who was Joe's doctor, said, come on in for a checkup. And this was just right after the funeral. So Joe went in for a checkup, and it was so soon after the funeral. Mike had just flown back to California at that time.
Hmm.
So Joe went in for a checkup and had an EKG, and an abnormal arrhythmia was detected by his family doctor, who had recently read up about Brugada. Dan hadn't caught his flight back to Boston, so we sent him up there. He had an EKG, and again, it was abnormal arrhythmia. So Joe's vacation got canceled.
Hmm.
So Joe went to a cardiologist right away, and he too recognized the Brugada. He was then sent to see an electrophysiologist to confirm the diagnosis. Joe had a procainamide challenge that indicated Brugada 1. He had the EP study and he went into VT immediately. He was shocked, and a defibrillator was implanted right at that time. So this was in like 2 weeks after Tom died.
Wow.
Um,
And what were they able to prove that
well,
Tom's Brugada syndrome was a genetically explainable one, or was his genetic
well,
test negative?
yeah. Well, Hale and I, we met with Joe's electrophysiologist in the recovery room, and we had Dan's EKG from the previous week, and we had an old EKG of Tom's from when he saw a cardiologist in Rochester when he was about 16 years old.
Hmm.
And at this time, the electrophysiologist, he recognized the Brugada on both of them.
So even on Tom's high school ECG, they felt that there
Yeah,
was a Brugada
I
pattern that,
guess just because way back then they weren't aware of it, and they were
yeah.
looking for hypertrophic cardiomyopathy too.
And so
So
with Tom's age 16 ECG showing a Brugada pattern, and then your son Joe getting confirmed with the procainamide test and the EP study, was
yeah,
Brugada genetic testing done to see if it was a genetically findable
mhm.
version?
Um, my husband Hale and my youngest son Mike, we went to have genetic testing, and they didn't discover the gene. They discovered the gene for the cardiomyopathy in
Mhm,
Hale, but no
mhm.
Brugada. Um,
And
so
as we know, for Brugada families out there, you can have Brugada syndrome, but have a negative genetic test. In fact, that's the most common scenario because the one definite Brugada syndrome disease gene, for those of you who have it, you know it's the gene SCN5A that builds the sodium channel in the heart, that only about 20% of all of our Brugada syndrome families have sodium channel mediated Brugada syndrome. Uh, it's higher than that. It's 40% if that Brugada patient has the Brugada pattern and evidence of conduction delay with a prolonged PR interval, then it's 40%. So it's for everybody out there. It's possible that Linda's son Joe and their deceased son Tom died from Brugada syndrome, and it's genetically negative or gene test negative Brugada syndrome. With that discovery in Joe, Linda, and looking at Tom's old ECG, did they then figure out where they think the Brugada is coming from, your side or their dad's side?
well, this is when we were in the recovery room, the electrophysiologist, he wanted to test me. So 4 days later, I had the procainamide challenge and the EP study, and he discovered Brugada number 2 in me. So it was then that we kind of suspected my older brother Steve. My brother Steve died at 47 years old in his sleep.
Hmm.
And I also have a nephew who died at 40 years old. And we wondered if that was Brugada.
And when your
And we
brother,
also wondered about in 10 years before Tom died, my son Joe, he had gone in to have jaw surgery. And at that time, the surgeon came out and were questioning whether Joe was doing cocaine.
Huh.
And I wonder if that was the Brugada right there.
Yeah, because
But
as
they,
you know, cocaine is Brugada dangerous, and cocaine can bring out an ECG pattern that looks exactly like Brugada. And so
mhm,
that's intriguing. I
yeah.
wonder, what you thought, Linda, or what you want people to know about Brugada syndrome. What's the most important thing that you want? I have a couple of things that I would have as the takeaways just from hearing your story for the first time. But what do you want the biggest takeaway to be about Brugada syndrome?
Well, I know I continue with when we went in July 2019. This was less than 2 months after Tom died. Dan was seeing to his health in Boston, and he saw a cardiologist. And the cardiologist looked at the EKG, and he thought it looked like a right bundle branch blockage. And so then he went to see an electrophysiologist who did the EKG, and the electrophysiologist recognized the Brugada, and it was at Tufts in Boston, a teaching hospital, and he had a couple of residents with him. So he just took Dan's lead and moved it a couple centimeters, and the Brugada pattern disappeared. So he was demonstrating how difficult it is to diagnose.
Mhm.
And then Dan went on. His doctor, since he saw it on so clearly on the EKG, they didn't do the procainamide challenge, but they
Mhm.
did the EP study, and Dan also went into VT and had a defibrillator.
Hmm. And
So
for your living sons who own defibrillators, have they needed their defibrillator to get called into action to rescue them from a Brugada
no,
episode?
no. But recently my husband's went off with
And
and
his
that
went
was
off because of the hypertrophic cardiomyopathy?
they actually found he had a blockage, so he had a stent
Mm.
put in.
Okay, wow.
Yeah.
And
But if that defibrillator wasn't there doing its job, you know.
wow, yeah. The other thing as you were sharing your story, Linda, I can't help but think of the missed opportunities that continue to happen, and how we at SADS Foundation have urged awareness of family story, right? To know your family history. And one wonders if the healthcare providers would have made more mentioning of your brother's death and asked you to get
Mhm.
carefully evaluated, might that have led to something? Or had
Yeah.
the ECG that was done in Tom when he was 16 had a different pair of eyes with a different brain between those
Yeah.
two eyes been looking at that ECG, maybe they would have thought, okay, I don't see anything for his dad's HCM, but I'm seeing this funny pattern in
Yeah.
V1 that looks like Brugada. And had they flagged it and caught it, because we know that when we diagnose Brugada syndrome correctly, the good news is tragedies like what you've experienced don't happen. The
Mhm.
tragedies happen when it sneaks up on us, and we get caught off guard and didn't know that thing was there, and then it reared its ugly head. And so sorry to hear that
Yeah.
that is what you experienced. But are
Right.
there
And
other things that you would want people out there to know about Brugada syndrome?
well, I know that Tom ran cross country and indoor and outdoor track 3 seasons in college, and just if a college routinely would test their athletes, you wonder if it had been picked up during all that running. And
Yeah,
but
so that
yeah,
brings us to the whole issue of,
uh,
should we be screening for
screening.
Brugada? How do we screen for it? Who do we screen for it? And as you shared, just by moving the leads a little bit, the doctor showed how your son's Brugada signal disappeared. And
Mm-hmm.
so we have a lot of challenges. I know there's some efforts to see if we can create a better Brugada detector electrically.
Mm-hmm.
So those efforts are in motion. I'm wondering, shifting from Brugada syndrome a little bit to how did you discover the SADS Foundation, and what has the SADS Foundation meant to you?
Um, I mean, we just looked up, sudden death, and you find SADS, and I just started looking at the website and stuff, and I know I think it was Alice that we were talking to that told us about Dr. Robert Hamilton, who's
Hmm.
in Toronto, which isn't far from us, and so we got in touch with him, and we told him our story, and he wanted to participate in some research with genetics. So everyone in my family, my sons and my husband and I, we've donated blood, which was real tricky during COVID trying to do this over the border. And he had a colleague in Buffalo that he was working with. And then in addition to my family, my sister and my brother and a niece and a nephew are also participating in that. So that's information we learned through SADS, and also about the Brugada project, the Link My Heart. My son Joe and I have sent in samples for that. The Dr. Stephen Lovett, I think, is running that one.
Great.
It's on Dan and Mike's to-do list. But
Well, it's so good of you
I
to participate in research, because as you know, it's only that way that when we have families affected by these rare, uncommon genetic heart conditions, that we need to get smarter about them. And the work, the Dr. Robert
mhm.
Hamilton's in Toronto, good friend of mine, he's been on SADS Live
Yeah, I've
before,
seen them.
uh, doing really good stuff, and hopefully he'll discover your family's genetic cause so that that can
Right,
serve as a gold standard biomarker for the rest of your family, for the future grandkids and future nieces and
right.
nephews and extended relatives. So thank you for
Yeah.
participating in
Uh,
the research. Other
Yeah,
things
that's
that,
where we we're curious because like my son on the other side of the country, he he's in California, my youngest son, and he'd been through a battery of tests out there. They did an echo, MRI, multiple EKGs, a stress test, and they all indicated no abnormalities. And so Hale and I flew out there. And in August 2019, 3 months after Tom died, Mike had the procainamide challenge, and that indicated Brugada 1. Either all those other tests showed nothing. And then he had the EP study, but it didn't produce the VT like it did in Joe and Dan. So, it just felt like the worst case scenario. He has the same thing that his brothers have, and nothing they could do because they're following the guidelines. He didn't get a defibrillator, so we bought him an AED to have on hand.
yeah,
And now,
yeah,
just in December, Mike had a baby. So that's our question. We're not sure, you know, the baby's already had EKG, but we
right.
don't know how frequently he's supposed to get tested, or there's so many questions
Yeah, there
how
really
to keep
are
him
a
safe.
lot of questions, even as we have discussed, and in this meeting that I'm flying to tomorrow, there will probably be a debate, as there is every year in Brugada syndrome, in terms of should we or should we not do an EP study in somebody who's never had a symptom, who shows the Brugada pattern. Do we do an EP study? And that debate has raged across the world. There are those who are the proponents for it. The Brugada brothers believe that it is a life-saving test and a procedure if done right. There are others who we recognize that done wrong, meaning too aggressive of an EP study, can make VTVF come out in anybody like me. And if you do it wrong or too aggressive, that it then comes back positive, then you force a defibrillator to be implanted, and then all you're going to get from the defibrillator are complications because you didn't need a defibrillator. And so I think the Brugada brothers and others are helping show the right way to do an EP study if you're going to do one. One that is less aggressive, so that if it's easily positive, then that might mean something more important in terms of predicting the future, allowing us to put in a protective device in your son, for example, while avoiding over implanting defibrillators because somebody did what's called a very aggressive EP study and got essentially a false positive. And so, a lot of debate on that yet. There's debate on, like you said, the screening ECG, and how can we find people? Like, how could we have that ECG that was done in your son when he was 16? Could we have created a better Brugada detector so that that ECG might have put off the sirens and not be so dependent on who is by chance staring at that ECG? And is that person somebody who's Brugada aware or somebody who is Brugada naive or Brugada clueless? So I think those are some areas of ongoing research and progress, and hopefully we will get to a point where
we had a lot of questions. We actually made an appointment with Dr. Brugada in Brussels for July 2020 because we just had so many questions about Mike and everything. But then, you know, with COVID, it had to get canceled, and then it was moved to November, and COVID wasn't much better in 2020. So, but one of his associates was communicated with us, and they mentioned something like an ablation for people like Mike. And they also said all my brothers and sisters should have the EKG and a EP study, but they haven't really done that. It's hard to get insurance authorization for these tests.
Right.
And we do know that my brother Steve's daughter has POTS, and we didn't know how that was, connected at all.
Yeah, so largely unrelated. I mean, a frustrating entity of its own, but not connected to Brugada syndrome. Linda, before I let you go, I'm going to give you the final word as to something that you want no one to ever forget about Brugada syndrome, or something that has meant a great deal to you from that the SADS Foundation provided. So I'll give you the last word, and then I'll let you go. And I have a few questions coming on the sidebar for me to answer during our remaining few minutes.
Well, we're thankful that the SADS Foundation has these resources so we can try to find answers, or, I've seen other parents who have lost children, and they're like on a crusade to put AEDs in schools or other public places, or some of them want to give CPR to bystanders so people know how to deal with a sudden cardiac arrest. But for us, Tom dying in his sleep at 30 years old, those wouldn't really help. The outcome would have been the same.
Right.
So
right.
I think genetics,
I think
and screening are the ways to go. And
right.
we don't know if we're just special with Hale's Brugada, and it was just a perfect storm with a deadly outcome.
Right. Well, we have so much work to do yet, and I'm grateful that you could take the time to give us awareness of things that went wrong and things that are starting to go right for your family, and through your family's experience, hopefully we can make a Brugada related death as
That's a picture.
unlikely as possible. So all the
That's
best
him.
to you, Linda. Blessings for the spring, and there's we'll see Tom's. Go ahead and share Tom's one of
Yeah.
his latest pictures there.
Yeah. This was at his brother Mike's wedding.
Hmm.
And this is we also wrote to EKG manufacturers seeing if they could fine tune or program their EKGs to kind of be aware of this. Like it'll say like consider ischemia or right bundle branch blockage or WPW, and we wonder, gee, could they do it for Brugada? But we never heard any responses.
Hmm.
This is the plaque Tom got when he um, went into the Wall of Fame. All the records he set.
Hmm.
So he was pretty accomplished,
Yeah. Well, Linda,
you
thanks
know.
for sharing your story, and we celebrate Tom and his life. And hopefully, out of his tragedy, we can make another family's tragedy not occur at all. So I thank you for being with us and being part of the SADS family. And we'll let you
Mhm.
go as I go on to the sidebar here. So, Aaron, thank you for arranging that with Linda Reubens and her story from Niagara Falls and the tragic loss of their son, Tom, in his 30s. Declaration of out of hospital cardiac arrest, sudden cardiac death during sleep as the way. But then you notice there was a story in Tom's maternal uncle, Linda's brother who dies in the 40s. Know your family story. An unexplained sudden death in any relative needs to be told to your healthcare provider because that may be relevant, not just a piece of history, but a critically important piece of missing information that may be relevant not for that deceased uncle, but maybe that deceased uncle's nephews, as in Linda's sons. And then when we get ECGs, even though it was many years ago, some maybe 14 years ago for Tom, apparently there was something there that was in retrospect there, and we need to get the there lit up better, a better ECG detector for Brugada, and we and others are working on a better Brugada diagnostic sniffer, if you will. So hopefully we'll have a smarter ECG in the future. So again, thanks to Linda and blessings to the Reubens family. 6 minutes on the counter. Now, if we don't get to these, I think our next program in 2 weeks, April 15th, is going to be devoted entirely to your questions, unless Aaron has a special program in the queue for us. So hello to Laura. As I mentioned, Sophie is asking me about the Novavax vaccine safety for people with acquired long QT syndrome. So far, the beauty of all current therapies, COVID-19 therapies, if you have the infection and now we need to treat you, or doing the vaccine to try to prevent the infection or at least prevent bad consequences from the infection, as in hospitalization or death, those vaccines are QT safe. Those medicines are QT safe. That's good news. So stay vaccine current, be vaccine up to date. I will probably get my second booster. I'm over 50. Although I've been coronated, as you know, in January, so maybe I have 6 months from the natural infection to figure out, do I need to be boosted when I'm already boosted plus Omicron? And I, like you, will be waiting for guidance as to what should I do for my health. And I encourage you to do the same. And if our leaders tell us, not political leaders, but our medical leaders tell us that on the risk benefit balance, it favors us to be vaccine current, then I encourage all of us to stay vaccine up to date. And we have a daughter with type 15 long QT. And that's a good point just to show that after we get past LQT 1, 2, and 3, most of us don't even use the number anymore because most cardiologists have no idea what is LQT 15 or LQT. So we're for the rare versions of long QT syndrome, we're starting to refer to those as calcium channel long QT syndrome, LQT8, or caveolin 3 long QT syndrome, LQT9. So we name it by the genetic substrate so that everybody knows what we're talking about. Then we see here from Bree, from Australia down under. I can't wait to go down under. I'm going there in August to, I think, is it called Queensland or Queen's Coast? I should know. My dear brother, Christopher, Dr. Simsarian, is going to be upset at me if I don't know the name of the city or the state. But they have type 3 long QT syndrome, and she has a defibrillator, and she's trying for a kid. Have fun trying for that kid. It's amazing to be a parent, even better to be a grandparent. But you're wondering, if you get shocked, will it hurt your developing baby inside you? Great news, it will not. And so if you needed that shock, or even if the device made a mistake and shocked you by mistake, your developing baby in utero will not really see that shock at all, and he or she will continue developing well. So blessings to you as you and try to conceive and create your baby. Let's see, question about LQT5 in the UK. Is it well known in the US? And so there, Laura, the issue is LQT number 5, which is uncommon. About 1% of all of my families, 1% or less, are LQT5. So of course, not very many people are very familiar with it, because you have to see a lot of long QT families to have 1% amount to anything. And we do see a lot here at Mayo Clinic. So it is common for me. It is not that big of a deal, honestly. It's very well treated, because the beauty of LQT5 is it acts a lot like LQT1. So we can use all of the knowledge we have from LQT1, where we know that beta blockers work great. Denervation surgery, if the beta blockers don't agree with that person, works great. And we can use that knowledge to help us take care of the subset of LQT5, the 1%er, that's way less common. And asymptomatic Brugada, since we're on Brugada theme, 43-year-old female. Is there any reason to have a stress test done? Well, in Brugada, the stress test is not that important. But in all of my Brugada patients, when I see them annually, or in the case of an asymptomatic woman, age 43, in my program, I would be seeing you probably every 2 to 3 years. We do a stress test as part of that periodic surveillance, just as an overarching way to look at heart health at rest, during activity, during 24 hours of electrical monitoring, just as a safety measure. But if I were forced to have to stop a test or not order a test in a 43-year-old like yourself, that test that would come off of my list first in the case of Brugada would probably be the stress test. So I use it, but if I were forced, I could see myself canceling that one. Well, we are at the top of the hour. And as we continue in this month of April 1st, happy April Fool's Day, everyone. I hope you will have your best month of 2022 so far. Live and thrive as you can and should and deserve. Be under a blessing. Try to be anxious for nothing, but in everything. By prayer and supplication, let your requests be made known to God. And may the peace of God, which passes all human understanding, keep your heart and your mind in Christ Jesus. So I give you that blessing for you. Think of me as we travel, and for our own travel mercy. And until 2 weeks from now, I wish you all the best. And I can't wait to take your questions and see if I can do a decent job answering your incredible questions in 2 weeks. Until then, blessings to all of you.